Hello, my name's Tristan McMullen. I'm an eye surgeon specialising in surgery in and around the eyes and eyelids, and I've been asked to talk about preparation for eyelid surgery today. This is an essential topic that I cover in detail with patients and give them written guidelines and instructions. But in essence, we're talking about optimising the results and minimising the risks. And I think probably the first and foremost thing that I'd like to bring out is the use of non-steroidal anti-inflammatory drugs such as aspirin, or ibuprofen, which is marketed as Nurofen, or diclofenac, which is marketed as Voltarol. And there are various others as well. And these can increase the chances of bleeding, and I ask patients to stop these 10 days before surgery, if, and only if, this is safe for them to do so. There will be patients who take aspirin, for example, for general health indications, either with their heart or because they've had previous strokes. And this needs a conversation that involves their GP, if their GP is looking after them, or their hospital specialist, and one has to balance the risks and benefits. But in an ideal world, I have them stop these medications to reduce the chances of bleeding. Similarly, there are over-the-counter products that can prolong bleeding time and make surgery more difficult, which can compromise the results in terms of the cosmetic outcome, and more importantly, can, if not addressed, increase the chances of complications. So the things I'm thinking of here are ginkgo biloba, garlic, vitamin E, and St. John's wort. And these are various over-the-counter preparations that, if you don't ask patients if they take them, you won't find out. And it's important to explore this. Similarly, smoking can adversely affect the outcome of surgery, and obviously smoking is bad for your general health, but in terms of cosmetic surgery, can affect wound healing, and in an ideal world patients should stop smoking, and if failing that, should avoid it in the sort of 2 to 4 weeks prior to surgery. In terms of the run-up to surgery, obviously it's best that patients have their health optimised and take it easy in the run-up to surgery, avoid too much in the way of heavy nights out, and should arrive for surgery rested and well prepared. And I think as long as these questions are addressed in the clinic and with written information that patients read, then there shouldn't be any last minute glitches. But those are the most important things that I like to cover. And in general terms, optimising skincare with moisturisers, and on the day of surgery, if it's sensible to avoid makeup and moisturiser. There are certain procedures such as peels which have a separate sort of preparation protocol which we won't discuss here and could be a topic for another occasion.